it still doesn't feel real. It just doesn't.
Well, my mama always worked in the medical field, and I think my mom is a very nurturing type person, which is why we're so close with her. And nursing just seemed to be the right thing, and it was also a way to support, as a single mom of 4, she needed an income to support us.
Without a man in the picture.
Without a man in the
and
picture.
she made that known. She was not scared to tell you. She volunteered to be on the COVID unit.
They had to change the cardiac ops floor to the COVID floor, and they had the option to either stay on their floor and be a COVID nurse or go to another floor, and my mom chose to stay on their floor.
She always wanted to help people.
She thought that's where she could do the most good, and she did. She did a lot of good.
She did a lot of good.
She told me some stories about losing patients, because it's hard when you lose a patient, especially when you go from being a cardiac ops nurse where you lose patients, but not really. It's people that you know, like you've had come in and out.
The families you meet, and
but then these people just start dropping like flies, because, I mean, especially Harrison County, you know, you have people dying so
Worst
often
thing.
because of this. She came home a Tuesday from work, and she didn't feel good. The next day she had fever. And I started taking care of her because I was like, you're sick, it's got to be COVID. But then we took her to a nurse prac, and she said, it could be a sinus infection, let's get you tested. And they tested her, and the test didn't come back. It was like inconclusive or something. So she had to go back and get tested. But by the time she had gone back and got tested, she didn't get what, it was like a slow slope down. And then one day I noticed her breathing was bad. I was like, Mom, why are you breathing like that? She's like, I feel like I can breathe fine. And I went to Walgreens and got an O2 sat monitor to see how she was breathing. She was breathing 62%. So I threw her in the car, and I drove as fast as God and the roads would let me.
they did absolutely everything they could for our mom, and we know that. She was well taken care of. They went
Above and beyond.
They really did, and I really want that known. Memorial Hospital has an excellent team, and they loved our mom. The nurses would come in there and just cry with us. I mean, they loved our mom.
COVID had left her lungs completely just fibrotic is the word. It just means they weren't working. They weren't working.
Her lungs had the consistency of paper.
They wanted to do a lung transplant, but she never got
to the point where she could have done that.
She was too critical. She was in COVID ICU for at least, it was
20 or 25 days.
Something like that, yeah.
With her being a single mom that went to, you gotta realize, like, she's a superhero in my mind. You always want to be like your superhero. Like, you grow up thinking like, oh, I want to be Superman, I want to be Wonder Woman. Well, for me, at least my mom is that living for real superhero, and I'm able to be that. I'm not able to be her, but I'm able to be like her. So nurses to me are superheroes. My mom was a superhero, and now I get to be a part of her in that. My only wish in life is to make that woman proud.
You did.
And I've got to tell y'all, whenever our mom, she wasn't sedated, we went in there and we were together, and Monica was able to tell her that she passed her boards, and our mom smiled. And that is the last time. That is the last emotion that she was able to show. But I know with 100% certainty that she was able to.
I thought she was going to try to get up out of the bed.
Just that she was an honest to God hero to not just to us. I mean, to a lot of people. She touched a lot of people's lives. She was amazing. She was truly amazing.